Hello, I'm Masichalo. This is Group 4, doing a first aid to a victim who was an electric shock. The first step, you switch off the electric from the main switch. The second step, you push the victim from the electric using a dry hood, making a distance.
So the second step is you assess the situation. You check if there's any response, if the victim is alert. So you check if the victim is alert. In our case, our victim is not alert. So you check for breathing signs. If the victim is breathing, by listening to his breath, if her breath, if the victim is breathing, and then you can also check the pulse, if the heart is beating like this. Then if there's no pulse, there's no breathing, you do what you can do. You can do CPR by pressing the chest. As you do what, you put air in the mouth. That is CPR. But if in our case our patient is still breathing, so we loosen the cloths. We loosen her clothes. We remove the shoes so that we can increase the blood flow. Then the third step is you make sure the victim is laid the back facing downwards. Then after that, if there are no injuries on the head, the neck, or the back, you are going to elevate the legs at least 12 inches to make sure you are going to elevate the legs at least 12 inches to make sure free flow of blood. Then if at all there are some injuries on the head, the leg, or backwards, you don't move the victim. Since our victim is getting cold, I will cover her with something warm, at least to regain the heat.
At this point, remember our patient hasn't gained consciousness fully. So at this point, you should not give any food or drink because if it can